Hello, everyone, and welcome to the 9th Annual Building Resilience Through Private-Public Partnerships Conference. I hope today finds you safe and it finds you healthy. I'm Mark DeCourcy, the Senior Vice President of the U.S. Chamber of Commerce Foundation, and I lead its Corporate Citizenship Center. In times of disaster, it takes all sectors coming together to drive meaningful change, and never has that been more apparent or more needed than during the current COVID-19 crisis. As the pandemic and the ensuing social and economic crises have spread across our country, collaboration for the private sector, public and nonprofit sectors has never been needed more. The crisis also laid bare the many vulnerabilities we face as a society and the need to build a community that is stronger for the next disaster. Today, we'll examine the past, present, and future of the COVID-19 crisis. To better understand how it has changed the world around us, what we can learn from this moment, and how we as individuals, communities, and organizations can work together to build a more resilient future. You can watch our opening video to learn more about today's conversations and the topics that will be covered. As many of you know, this is the first time we're hosting this conference virtually. I'd like to thank DHS, FEMA, and Northcom for bringing this all together with us for these important conversations. Along with these federal partners and National VOAD, we're proud to name this week, July 12th, as National Partnership Week for Disaster Management. Also, this event would not be possible without our SHAPE leaders, who support our disaster preparedness, response, and recovery programs here at the Chamber Foundation. In addition to our SHAPE leaders, I'd also like to thank our event sponsors for their help in creating this conference. Now it's my pleasure to start today's programming by introducing our opening keynote speakers. First, you'll be hearing from Sameh Wahba. He is the Global Director for the World Bank's Urban Disaster Risk Management and Resilience Practice. He'll talk about the world in 2020, the lessons learned from COVID-19, and what may be on the horizon as we work towards a return to normalcy. After his presentation, we'll hear from Dr. Jeffrey Stern, Superintendent of FEMA's Emergency Management Institute, and Andrea Davis, the Senior Director of Global Emergency Management at Walmart, on how COVID-19 has reshaped the field of emergency response. But before we get started, I want to thank you and remind everyone that during all of our sessions, you can submit questions on the chat box. We encourage you to connect with our speakers and other participants in real time to help us make this event as engaging and collaborative as possible. You can also join the conversation on Twitter using the hashtag PPPCONF2020. That's PPPCONF2020. With that, I'll turn over to our first speaker, Sameh Wahba. Please take it away.
Thank you very much, Mark. A pleasure for me to be here. I wanted to share with you some insights from the World Bank Group about disaster risk management and resilience today. So if we can load the presentation, please. So if we can move to the next slide. Why is disaster risk management and resilience relevant to the World Bank? Next slide, please. Our twin goals of eradicating extreme poverty and boosting shared prosperity, meaning reducing inequality for the bottom 40% of the population, is constantly being tested by disasters, whether they're extreme weather events or pandemics such as COVID-19. That's because the poorest are the most affected by disasters. And whatever development gains we have achieved globally, it takes one disaster, one pandemic to wipe them away. Why is that? First, because the poor tend to live in disaster-prone areas in cities, in places subjected to floodings. Because they lack security of tenure, they live in fragile buildings, and they're likely to lose all assets in disasters. Natural disasters, or disasters from extreme weather events, if we manage to prevent them, we'd manage to stop 26 million people from going into poverty. COVID-19, by virtue of the estimates that we're seeing, could easily add between 100 to 200 million people into poverty on account of how long it would last. Next slide, please. Now, disasters bring about extensive damages to infrastructure. We estimate that there's $30 billion annually of damages to transport and to power generation. Next slide, please. But these damages are nothing compared to the economic losses that arise to firms and to households because of interrupted sales, reduced utilization rates, and the willingness to pay by household to avert disasters. Next slide, please. Now, we know that climate change is exacerbating disaster risk. We're talking about 920 million people exposed in 2010, increasing by more than 50% by 2050. As for asset losses, they are more than tripling between 2010 and 2050. Next slide, please. Urbanization is further compounding the risk because it adds an increasing concentration of people and assets at risk areas, whether it's from flooding or other disasters. Next slide, please. The third important vector is the quality of infrastructure and housing. So we've done some work in Nepal after the earthquake, and if we improve the building code over there, we could avert in 15 years 20% of the losses that have occurred. Next slide, please. This means that it is critical for us to work on disaster risk management across a range of issues, starting from risk identification, followed by risk reduction, risk preparedness, financial protection, and then lastly, in a post-disaster event, by focusing on resilient recovery. Next slide, please. We tend to work in a comprehensive approach. In Turkey, we've worked across the 5 issues by focusing on risk identification to the vulnerability of cultural heritage and public facilities, on risk reduction by doing seismic retrofit for all sorts of public buildings, strengthening preparedness through training of disaster professionals, providing financial protection and insurance solutions to households, and then post-earthquake, as in Marmara, the rebuilding process. Next slide, please. On risk identification, if we go to the next slide, we have put together a global community of experts called Understanding Risks that meets every 2 years to share important advances in risk mapping, risk identification, and modeling. Next slide, please. We've taken these skills and applied them to our projects, like this one in India, where we've done risk modeling and risk analytics. Next slide. And in African cities, we've worked on mapping African cities to be able to provide risk-informed land use planning. And we did that by harnessing the power of youth, by teaching them digital skills and helping create jobs in disaster mapping and to strengthen preparedness. Next slide. We've used also artificial intelligence to do an assessment of the buildings to assess which ones are vulnerable for destruction from an earthquake or from a cyclone, such as this particular program. And it allows us to deploy this analysis throughout an entire city in something like 3 weeks with a success rate of about 80 to 90% when you compare it to the actual survey on the ground. Next slide. In risk reduction, if we can go to the next slide, one example of the approach that we have is this program we have in Mozambique, which is a cities and climate change program. It approaches disaster risk reduction through an integrated approach, strengthening resilience of climate change by putting in place flood protection infrastructure, but also investing in land use planning and also enforcement to prevent the urban encroachment on floodplains. And then lastly, investing in solid waste management to reduce the amount of garbage that flows into the drainage canals and clogs them. Next slide, please. We also work upstream as this project in Sri Lanka, where we've done dredging, embankments, and preventive resettlement to reduce the flooding of the capital city, Colombo. Next slide, please. And we invest significantly in building regulations, strengthening countries' and cities' ability to put in place resilient building codes. Next slide, please. Preparedness was particularly laid bare by COVID-19 in the sense that many cities have not had the appropriate preparedness. Now, in general, the way we approach it is we have an important hydromet program that works on improving hydrological and meteorological systems and modernizing service delivery. We invest in hardware, in software, and in the preparation of the information that would be needed by end users, such as the aviation industry, such as farmers, such as local governments, to be able to cope better and prepare better with disasters. Next slide, please. And we take this approach also at regional level by operating as we do in Central Asia with a range of hydromet agencies in the various countries out there. Next slide, please. In terms of financial protection, there are two main instruments that I wanted to share with you. The first one, in the next slide, is our catastrophe deferred drawdown option, which is this slide. This is basically a development policy support program that puts in place disaster reduction and preparedness policy, works on them with the country. And once they're put in place, it avails a line of financing in the form of a credit line that countries can draw on in the context of, or in the aftermath of a disaster, to basically cope with the increased costs of addressing this disaster. This way, the policy support that goes upfront helps countries reduce vulnerability and exposure to disaster, and the financing line after the disaster prevents countries from having to cannibalize expenditures on health and education to attend to disasters by availing this special financing. In the post-COVID-19, we had 18 such instruments at country level, and nearly all of them have dispersed to date, and they dispersed literally within a day or two of the declaration of national emergency. Next slide, please. We also have a catastrophe risk pooling, whether at country level, where we do parametric insurance for national and local governments, or at a regional level, like we have in the Pacific, in Southeast Asia, and in the Caribbean, by doing a catastrophe risk pool at regional level. Next slide, please. Lastly, on resilient recovery in the aftermath of a disaster. Next slide, please. First, we put in place mechanisms by which we do disaster and needs assessment very rapidly. So we use artificial intelligence, satellite imagery, and all sorts of disruptive technologies that allow us to assess remotely the buildings and structures that got affected. In the right-hand side, this was the case of the Sulawesi earthquake and tsunami in Indonesia. And literally within 9 days, we've provided the government with a report with the detailed assessment of the 20,000 plus structures that were affected by this disaster. It allows the government to immediately think about putting in place their reconstruction and resilient recovery plans. Next slide, please. We support the governments, as in the case of Kerala, on putting in place integrated resilient recovery initiatives. This is post the floods that affected them in the past couple of years. And these are interventions spanning agriculture, land use, fisheries, livelihoods, cities, disaster risk management, and environment. Next slide, please. We also take these skills and we transpose them to conflict settings. So how do you do also assessments of post-conflict needs for reconstruction, whether in countries like Yemen, Iraq, and Syria? Next slide, please. To conclude, if we go to the next slide, I think the case of Bangladesh provides us with a particular telling story about the importance of investing in disaster risk management. This is a country that's faced with some of the major disasters that you can imagine, and the challenges are enormous, but change is possible. Next slide. And the proof of it, this is the case of two cyclones, one in 1970, one in 2007. 1970 Cyclone Sidr killed 500,000 persons in Bangladesh. After nearly 4 decades of investment, a similarly destructive cyclone in 2007 only killed 3,000 people. It's 3,000 too many, but you compare it with the earlier fatalities, it is a major improvement. If we go to the next slide, it tells you what Bangladesh has invested in. It invested in coastal embankment improvements, in key protective infrastructure, in urban resilience, in building schools that also double up as multi-purpose disaster shelters, and in all sorts of adaptation to their agriculture to cope with an increasing sea level rise, saltwater intrusion, and cyclones. Next slide. And with that, I thank you very much for your time. Thanks. Back to you, Mark.
Thanks, Dr. Wahba. This is Jeff Stern. I think we're live now. There we go. And my friend Andrea Davis from Walmart. So we're glad to help kick off this year's conference. Obviously a little different doing it in the online space, but also we can fit a lot more people in the online world, even though we can't see you, than in that fantastic banquet room at the U.S. Chamber. And I was privileged to attend a couple of these conferences over the last few years. Andrea, you want to introduce yourself really quickly, and then we'll sort of go through a little bit of a conversation back and forth to discuss disasters in 2020 as we go to the bottom of the hour.
Sure. Thanks, Jeff. Hi, everybody. Hello from beautiful Bentonville, Arkansas. I'm looking forward to the day that we can see each other again, and I get to invite you out here. So very, very glad to be here, Jeff. Thank you.
Thanks a lot. So I'm Jeff Stern. I'm with FEMA. I'm the superintendent of the Emergency Management Institute, and I've got tenure of about 5 weeks on that job. And I think the reason the chamber team asked me and invited me here was actually based on my prior job. I spent the last 6 years as the director of the Virginia Department of Emergency Management, where over that 6-year period, we led the state through about 50 major disaster incidents, ranging from hurricanes, tornadoes, flooding, to incidents like the Unite the Right rally and the domestic terrorist incident that occurred in Charlottesville, and obviously the first few months of the coronavirus pandemic. And never had I seen in my career, have I seen more engagement with the private sector than in the coronavirus incident. We engaged in ways that we never thought we could or would on an unprecedented scale. And that ranged from the obvious of working closely with the Virginia hospital systems to ensure that there was adequate bed capacity during the first initial beginnings of the pandemic, to really establishing sort of a robust statewide logistics system with partners from Estes Express, a regional trucking network, and FedEx to take in the delivery of supplies. We leased 747 cargo aircraft to fly supplies in from China, PPE, land them in Chicago and Dulles Airport, have them trucked down to Richmond and distributed through a series of warehouses and hub network that we had stood up, to thinking strategically about our needs using companies like McKinsey and Deloitte, doing data analytics with partners at Esri, and using companies like Data Miner to look at the trends that we're developing and where there might be hotspots or outbreaks, and then drawing on resources like the RAND Corporation and the University of Virginia Biocomplexity Institute to do modeling. And that's ongoing today, even as I've left. But we got to a point in Virginia where we literally had offers from, I think, about 1,300 different private sector entities to provide supplies, to have brewers and whiskey distillers convert to producing sanitizer that we distributed to first responders and to the medical system, to companies that are coming online today in Virginia that are converting their supply chains to actually make PPE, both for the public and for the citizens. Just really sort of an amazing engagement. And I think there are a lot of lessons as I observe the transition from that role at the state level engagement to seeing how FEMA, which has also been very engaged with the private sector and really has been a seamless partner with the states. I think all my peers in the state director cadre around the country would agree with that. And so it's been an interesting transition to step back to the federal role. My role at EMI is to help train responders, and I think we're going to be train the emergency managers, educate them around the country, and we're going to be looking a lot at how do we further develop programs to further engage the private sector, and then develop partnership education programs to operationalize that. Andrea, could you talk about your transition? You're at Walmart now this year. You came from Disney. What was the engagement as you've transitioned there, and how you've been dealing with coronavirus, and what are you seeing?
Thanks, Jeff. Well, I have to say, this has been quite the adventure so far. So I left Disney after 7.5 years on January 3rd. On the 4th of January, I got on a plane and flew to Bentonville, Arkansas with 2 suitcases and my cat, Mr. Boo. And I started work with Walmart Corporation on January 6th. I had no idea what was in store for me literally starting the following week. Because the reason I jumped at this chance, and many of you might remember last year, I was on a panel with Jason Jackson, who was in this position. And when I saw that he was leaving, I called him up and said, "Hey, Jason, do you think I might be a good fit for this position?" And he said yes, and he said, "Go for it." Because to have the opportunity to be at the helm to lead emergency management for the world's largest retailer was just something I was so excited, like a challenge that I really wanted. I mean, little did I know what the challenge that was going to be in store for me, because I don't think I truly comprehended the volume that is Walmart. And when we saw the coronavirus outbreak with starting in China, Walmart had a huge presence there. And so I just immediately kind of came from this feeling of like, well, I came from Disney. It's the world's largest entertainment company. But just the size and scope was so significant for me. And then, as this is developing, I don't know the lingo here at Walmart. It has a very set culture. I have an amazing team. Thank you, Jason, for what he created. And the legacy that Walmart has in emergency management is what attracted me here. And so I felt, just even as a new leader for the team, that I wasn't going to be able to support them, because I truly was presented with a new situation with this coronavirus, and then having it compound that with being brand new to this job. And then life goes on, right? I know all of you had to deal with many life events. And so, as I said, I got on a plane, I moved here, and then there's all those things that come with like moving and selling homes and getting into a new place. And look, Southern California is nothing like Bentonville, Arkansas, as far as climate. So I had no experience with ice, slipped and hit my head on ice, and then also had a terrible engagement with blood-sucking ticks. So I'm having to learn all these like personal things as I'm trying to lead the helm of this team. And I will have to say, as this is progressing, as we're seeing the stress on the supply chain, and our typical partners, just like you, Jeff, with the state of Virginia, reaching out, needing different supplies. It wasn't like a hurricane where we could just say, "Hey, we got you. We can send you water. We can send you these supplies," because this was impacting all of us. And there was a significant strain on the supply chain. And so that was almost from the emergency management standpoint of like, this is how Walmart helps. And so we had to shift even how we could help when we saw such a strain on the supply chain, and make sure that we're still engaged with our state partners to understand where the most need was. And then secondly, and I know all of the emergency managers on here were confronted with the same problem, how do you transition your trusted space, which for Walmart in a time of crisis was the EOC. Everybody would come to the EOC, hundreds of people. I had never seen anything like it. And it was state of the art. It was fantastic, but everybody would come there. It was a safe space. How do you make that virtual? How do you take that feeling and make it virtual was another compounding problem. And so as we're seeing this progression, as we get into March, and we're seeing how this is going to impact us here domestically, we're like, we got to be forward thinking. We got to make sure this transition is not a force. It's that we're ready to go. So we're trying out and testing all the technology. And then, a lot of times I feel sometimes like Lucille Ball of emergency management. As I'm testing out the technology, Jeff, I'm sitting in a bar stool like I am today. And of course, I have all of our top executives call in to see if they can see me. I'm wearing a skirt. So I literally flash my entire executive council. And this is all in my first month of being with the company. So I really felt like, okay, great, massive world problem, brand new job. And I didn't feel like I even had the tools. And one thing before I want to kick it back to you, I know Dr. Marcus is going to be speaking later, and I just want to thank you, Dr. Marcus. I went through, the Leadership Academy at EMI, Jeff, and I remember Dr. Marcus talking about meta leadership and where your brain goes to the basement. So when I was able to kind of transition to putting on my big girl pants and saying, hey, this is no different than any other crisis we have ever dealt with. What crisis haven't you had lack of information? What crisis haven't you had dangerous conditions? And what crisis hasn't there been extreme politics in? And so once I kind of made that mental shift to this is the way I've got to think, I felt I was a better resource to my team and a better resource to the state partners, such as yourself.
Well, that's fantastic. And thanks for sharing those stories. And shameless plug for Dr. Marcus's book, You're It. I'm sure he'll be discussing that later, had on my desk. You keyed on a few key things there that I want to pull on. One was the need to be agile. And I'm sure our private sector partners and everybody watching this feels that. We definitely had to change our basic plans from they say the first casualty of war is the plan with and we found that was true in Virginia. We had a pandemic flu plan, but we had to virtualize our state emergency operations center immediately. We had the very first state employee out of 105,000 state employees to actually contract the virus in week 1. She's okay. The team was okay, but we took a EOC that normally would have a couple of hundred people in it and pared it down to a couple of dozen and virtualized over 1,000 people to support the operation and learned a lot of adaptive behaviors with that. And we also brought on private sector partners to help us do it. The McChrystal Group is one that was really fantastic that has been helping the Department of Emergency Management to do operational syncing. The second lesson I think we learned was that we couldn't separate disaster operations from day-to-day operations any more than the way we normally would as an organization. We've had in the months to learn, and I see FEMA doing this too now, how to operate the basic business lines at the same time we're dealing with the crisis. And then the third, I think, key thing gets to your personal stories of dealing with the ticks and the ice is for the first time, we're all affected by the same disaster. There's no geographic separation of us helping survivors. And so we need to learn ways to be personally resilient and make sure our teams and our organizations also remain resilient as we face, it's likely another 18 to 24 months potentially of this, short of there being some miraculous scientific leap with a vaccine. Andre, any closing thoughts? Did you find any other lessons that you would sort of observe as this has been going on that have come to the forefront as you're thinking through this?
Well, just remember, everybody out there, remember your training, remember what you've been through, because like you said, Jeff, this is a marathon. We got a bit to go and you're going to slip on ice. You may even get bit by blood-sucking ticks. You might even flash your executive council. But at the end of the day, you're an emergency manager and you got this.
Thanks a lot for that. I think my closing comment will be that I think the private sector needs government. Government needs the private sector. This is, FEMA's used the term for about a decade, a whole community effort together. And we're all going to get through this together. I do believe, sort of in the historical nature of these pandemics that they last a year to 2 to 3. We can all sort of embrace the Stockdale paradox of the immediate challenges are difficult, but in the long run, we will get through this. I think that brings us to the top of the hour, or the bottom of the hour, I guess is technically at 11:30 here on the East Coast. Mark, I think it's back to you, but I want to thank you all and have a fantastic couple of days here with this a tremendous program, and look forward to us being back in person at the chamber in that banquet room again with the big American flag, hopefully in a year or two. Thanks.
Thanks very much.
Jeff and Andrea, thank you so much. And we do hope that we're back at the Chamber building next summer with that big American flag. And thank you, Dr. Wahba, for your comments as well. It's great to have a domestic as well as an international perspective as we kick off this event today. We want to transition to breakout sessions now, and I want to highlight some of the unique collaborations that we have and these networking opportunities on this virtual platform. Again, we're trying this for the first time, so bear with us. You're going to be able to network with management experts, reserve virtual rooms for peer-to-peer conversations, and host group brainstorming sessions. You can also visit our virtual networking lounge at any time during these sessions to make a new connection and even a virtual happy hour. You can click on meetings and networking in our event lobby to learn more how to do this. And that's also where you can access our social wall, all of our social media accounts, and interact with other participants and stay up to date in the latest conference news. So now we'll transition to our first breakout sessions. You can join the breakout sessions by visiting Agenda on our event lobby and selecting the one that you want to go to. And following these breakout sessions, we'll take a 30-minute break and be back at 1 o'clock to resume our regular programming. Thanks again, everyone, for being here today.